All this is Dr. Drbeen Sayed from Drbeen.com. Welcome to one more show. So this is for Asia and Europe, and then one of the African cool bean and some others, they reached out and they said, well, this is for Africa as well. We are in a similar time zone. So Asia, Europe, and Africa, welcome. Let's have our discussions and a couple of announcements. One, I want to take Saturdays off for the morning shows. I find it difficult to be able to get up and ready on Saturdays, considering it's a weekend. So I hope it is okay with you. And secondly, tomorrow, especially, I want to have an off. One of the close family members of my wife, they passed away of COVID. And so I want to be with my family during this time. The history was that they're 72 years old. He had some comorbidities, I believe, diabetes, but he did not believe in COVID. And so this is happening within my own family as well, that there are people within my family who don't even believe in COVID. Then there are people in my family who don't believe in ivermectins and those. And then there are people in family who believe what I'm saying and they use ivermectin. So even within one family, you would see these tiers of various beliefs. So he did not believe in ivermectin at all, COVID at all. He just thought it is nothing. And when he did catch it, he then refused to get any treatment either, because once again, he thought it is nothing, to the point that he became so worst that his family members had to pick him up and take him to hospital, where then he passed away of cardiac arrest after, I think he was on ventilator for a few days. So this is a sad situation, and I want to be, as I said, we're making calls and we are talking, and just want to be with my family. So just tomorrow, if I could take an off for this reason, and then going forward, if I could have Saturday mornings off, I'll continue with the evenings. So this tells me how serious this disease is. And on the flip side, it tells me how easy this freaking disease to control is by things like ivermectin. And the humanity is still struggling. It blows my mind that we have reached this point. And I was listening to Dr. Pierre Corey, and I totally agree with him that the opposing side, the vaccine side, the big pharma side, the big org side, they have deeper pockets, they have higher influences, and they have better control over the matters. And so they can make policies, they can fraudulently make policies, they can give verdicts which are false, and nobody can do anything. And in that process, while they're taking care of their own interests, they are damaging people. So look at this. The person who passed away, he has two daughters, and they cannot believe it that their father he was so kind to these two daughters that you cannot imagine how protective, how kind he was, how much he cared for them. And so all of a sudden he's not there. So this is a devastation for that family. One of the daughter has locked herself in a room, not locked, but she's gone in a room and she doesn't want to talk. She does not know what to do. And the other daughter is just continuously crying. So when we look at these things as numbers, how many numbers and how many numbers and less numbers and more numbers, and 75% death rate reduction is not significant for WHO and 50% is not significant. I believe one death reduction is significant. And this is a weird drama that is going on. And I hope at some point this would come to an end. It can come to an end with ivermectin. So just keep trying your best, whatever way you can do it, to support ivermectin or to support hydroxy. Somebody made a comment yesterday that why does Mubin not agree with hydroxy? They probably have not seen my older videos where I've talked a lot about hydroxy. I am actually one of the fewer first folks who talked about hydroxy, zinc, ivermectin. In the US, the ivermectin momentum was generated by my talks in April and then onwards. So I'm happy it is catching on. So let's just keep moving forward. On one end, it is just this simple to control. that give ivermectin to everyone, hydroxy, zinc. Again, this is not an advice for anyone because these things can cause, especially hydroxy, can cause reactions. But the problem is these are solutions that can be given and doctors can know how to prescribe these and control this. Believe me, this pandemic can become just nothing but a nuisance of, hey, I have common cold like thing, if these drugs are added on to the regime. And here we are struggling with pandemic, people are dying, vaccines are arriving, and you know what's going on. Okay, so with this, let's start. I had seen a question right at the top. Let me see if I can get to that question. Here it is. Sumeet Kaisare says, can a vaccinated person donate plasma if spike protein antibody titer is good? That is a very good question. So if they are vaccinated and the value is great at the time of donating plasma, then sure. So if the titers are similar as the titers that are usually expected from convalescent plasma, then yes. Otherwise, no. So yes, your question's answer is yes, the proteins are there. Robert says, hi, good evening from Holland. Good evening. How are you, Robert? Susan Pick, cat, morning, cat bean, the kidney bean. Excellent. So we'll soon have our registry started as well. Paul Bork says, Dr. Patricia, so there is a separate discussion going on. Morphin says, question, can aspirin prior to vaccine prevent the clots being caused in Oxford vaccine? So let me say if I was asked to take Oxford or Johnson & Johnson, because they both are adenovirus, I would be putting myself on aspirin on daily basis even before the vaccine, then the vaccine, and I would keep myself on aspirin. And if, God forbid, there is any chance of feeling of thrombosis, for example, blurry vision, persistent headache after 3-4 days, cold legs, petechial hemorrhages, bruising, shortness of breath, and these are persisting, they're not going away, then I would probably go back to the doctor and say, okay, give me an oxaprin or give me something more as well. But yes, so the short answer is yes, but at the same time, please, this is not an advice, because I hope you understand it. It is not necessary that I know what is your history, what is your medical condition. Aspirin can cause blood thinning. Usually it's pretty benign, but still it can cause harm. So please don't take it without your doctor's advice. I totally understand that even doctors nowadays, so if you go to a doctor and say, I'm going to have a vaccine and I am afraid of that and I'm going to be on blood thinners, they're going to start laughing. So that is a problem. For example, yesterday, somebody had tweeted at me to say, hey, I heard your video, one of the videos about blood clotting, and I'm not impressed. So I thought that the feeling was mutual, because I was not impressed with their comment either. But this is what's happening in the medical field as well. Okay, so one request to everyone, the morning folks, if you have a question, just put QQQ or question mark with the question so I can answer them. Number two, please don't make it very specific. For example, here is my condition, what do I do? Or here is my brother and what do I do? I can't answer those questions. I should not answer those questions. It is not right. I'm not here for prescriptions. You're not my patients. I'm here to educate ourselves and keep ourselves up to date. Kurt says, my brother-in-law is in Idaho and has tested positive. He has headaches and muscle pain for 3 days. He needs Ivermectin now. Pharmacy won't fill script. Ideas. This is criminal. So over here in the California, there were some pharmacies that had refused. And what happened was that doctor then called in and they said, hey, this is an off-label use and I am using it. I am responsible, not you. And they cleared it. Secondly, what I understand is that, for example, here, you can go to CVS, and if they don't do it, you can go to Walgreens, and if they don't do it, you can go to Walmart's. So there are multiple pharmacies that can do it. There are some private pharmacies that are doing it as well. So please see if that can help. Stay in touch with me. He is positive. He needs it right away. We should figure something out. Have you seen the doctors on flccc.net? The problem is that pharmacy is not doing it. Is it possible to go to a different pharmacy? If not, then some of us will have to ship it to you. Jem says, my condolences to your family, but Dr. Bean, this pandemic is not just about virus, it's about big pharma. Yes, that's exactly the point, Jem. And this is just so disappointing and angering that they are doing this. You have seen folks who have been here with me for a year. I usually do not say, if we had done this, then we would have saved so many lives. The reason I don't do this is that it is kind of adding trauma to people who are already in trauma. For example, the family member that died yesterday in my family, if somebody comes to me and says, well, if you had done this, or for example, if I start saying to their family, his daughters, if he had listened to me and taken ivermectin, he would be safe, then it would sound weird and not very helpful for a grieving family. So this is why I kind of avoid usually saying this. But it is actually, if you wanted to, as I heard from other doctors as well, if ivermectin-like things are more prevalent, hundreds and thousands of lives would have been saved. Liza says, question, what can be taken instead of aspirin? Antiplatelet or factor 10 blockers. These are the two important categories. So blood clotting things or blood thinners are usually of two categories. One are antiplatelet and the other one are anti-blood clotting factors. So any of those, so antiplatelet, apoprostenol can be taken, or as that research worker had shown, that rivaroxaban or apexaban, or they even suggest IVIG or IV3, immunoglobulin 3 as well would help. So there are lots of options, just not heparin itself, because heparin, this disease is like heparin-induced thrombocytopenia. So we do not know that if we give heparin for blood thinning, and that would go in and aggravate the situation, then that becomes even bigger problem. So Muhammad Zubair says, does ivermectin decrease the efficacy of live attenuated vaccine like Sinopharm? No. So let me draw this, because I know that I have drawn this for other vaccines, but not for the live attenuated. So let me draw this and share why not. So the point of these inactivated, I think for SARS-CoV-2, there is no live attenuated. There are inactivated. And Sinopharm is not actually a live attenuated one. Sinopharm is actually, I believe, some other type. The inactivated viruses, for example, Bharat's vaccine is inactivated virus. So for inactivated virus, I can talk about it. I don't think they're taking a risk of creating a live attenuated SARS-CoV-2 based vaccine. It's just too risky. So when this is a dead virus means that the RNA that is present in the virus has become bonded with the chemical substances that have made it inactive or destroyed and damaged. So this is really nothing but the dead body of the virus, and that also is sort of damaged. Now, this virus cannot actually enter the cell. This virus cannot do any active things. This virus will be broken up. So how would it be broken up? It would be eaten up by macrophages, or it will be eaten up by neutrophils. Natural killer cells do not do this function of picking up an antigen and breaking it apart. They don't do that. So NK cells are not involved in it. The first thing that would be involved is going to be macrophages or dendritic cells. They are going to connect with the virus and they are going to phagocytose it. That means they are going to eat it in a small bag. They will ingest this virus in the form of they would wrap it into a small tiny bubble. So what happens is, let me take my glove off. It's bothering me for drawing. 1 second, please. Let me wear my normal drawing gloves. Sorry, my hand has tendinitis. So, okay. So what happens is that this virus will kind of, once it is attached, that place in our cell membrane where it is attached, that place would start invaginating inwards. And as it invaginates inwards, it would start closing. So eventually, here is the virus, and this cell membrane piece has become enough invaginated that this kind of becomes a bubble inside, and then it closes here, and we get a phagocytic vacuole. In this vacuole, then we process this thing, and that is we destroy this antigen by attaching lysosomes with it. Lysosomes are digestive enzymes, and we connect them with this. So this is like you put the virus in a pressure cooker and then you put spices on it that would destroy it. So once that is done and the smaller pieces are made, those pieces are then loaded and presented, and then the rest of the immune system works as we know. So this is how inactivated SARS-CoV-2 works. And so if we have ivermectin does not interfere with any of this process. We have done this discussion in the past. Ivermectin would interfere if, so let's say the virus is going to attach to these ACE2. So this ACE2 attachment can be hindered by ivermectin. That is one. So attenuated, inactivated virus, or the spike proteins, or what is that? Novavax's lipid, the spike protein lipid particle. None of those do this. So ivermectin stays functional in case of a vaccine, but hinders the actual virus. Then when the virus comes in and it makes its RDRP, and that RDRP is then helping virus replicate, ivermectin can disrupt this enzyme, but an inactivated virus doesn't do that. It is just brought in and then chopped further to be cooked, right? So here RDRP is not functioning. So ivermectin works on RDRP, not here. So fine with the vaccine. Then it can ivermectin can disrupt 3-chymotrypsin-like protease, or the enzyme, which is also virus's enzyme, and that would be disrupted by ivermectin. Here, it will not be presented, it would not be created, it would not be used in case of a vaccine, any vaccine, and so ivermectin would continue to be fine in that case, not hinder the vaccine. Then this possibility of virus sending the cargo in the nucleus and making the defenses, for example, interferon secretion reduced, that also this inactivated virus is not going to do it. So when the ivermectin is present here, that function would also neither the function will be present nor it would be disrupted. And finally, we know that there is one function, and that is the nuclear factor kappa B. This inflammatory pathway is common for vaccine or the infection, and that is where ivermectin modulates a tiny bit. So you could say that maybe it would take care of some of the pains and those things, but not much. This is why inactivated vaccines are not affected by ivermectin, neither other vaccines. So I hope that helps. Yes, so Germany has changed their criteria to say, let's give ivermectin to over 60, where they have not seen these cases. There are some other countries that are so I'm just seeing the question. So Robert Jeong says, today the Dutch government has stopped the vaccine AstraZeneca to be given until April 8th because of 5 hit incidents that happens, and one per is, Germany's already stopped giving AstraZeneca since Tuesday. So again, I know that people really hate me for talking about AstraZeneca, and I am getting so much of a pushback for why do I do it. But in these cases, so this is what I'm going against my own principle now, that if some damage has done, then saying, hey, it could have been prevented sounds mean. But remember, I did this video to say that in these kind of cases, if the physician is aware, then they can try to use anti-clotting and help. Anyways, So Avinash says, is there a vaccine study done on pregnant or breastfeeding women? So Avinash from Israel, the doctor that joined us, she had said that Pfizer's vaccine has been given to pregnant women without any issues. So I think that is where it is happening. I haven't yet seen the data from Pfizer or Israel that shows exactly what is the effect on this, but they are using it. Now, what I do not know is breastfeeding. However, there has been a study on the actual infection in the past, and that had said that a mother who was infected and has antibodies actually send protective antibodies to their child through placenta, or this is called a vertical route. So it is actually protective for baby that the antibodies are sent. And there is no evidence that the disease itself can be transmitted to the child. And maybe there is, maybe I haven't seen those researches. Let me say, instead of saying there is no evidence, I should say, I am not aware of an evidence, or I don't recall reading it, that infection goes to the child. But I am aware of the study that I read and I presented where the antibodies, and we know, I always say that, hey, IgG, immunoglobulin G is in the shape of a tummy, and that is also the shape of a pregnant woman. So G crosses placenta and goes to a child. That's just a way to remember. And IgA is sent out in the mother's milk. So IgA is protective for child's GIT and surfaces, and then IgG is protective before birth for the child, and child is born with those IgGs, and they protect him for some weeks to months. Fran says, which is better for the body, ivermectin if infected or vaccine? Age-dependent response maybe. So when infected, vaccine cannot really help right away, because vaccine and infection are at that time the same thing. Infection is going to trigger the immune system as well. Vaccine is going to trigger the immune system as well. Now it just is a race between them, that who triggers the immune system fast and first. So rushing to get a vaccine when a person has become infected is not very useful. The ivermectin, of course, is useful. Ivermectin in prophylaxis is useful. Ivermectin during the active infection is useful, and ivermectin after for some time is useful as well. And I saw a Cool Beans comment yesterday. They said that they got ivermectin, and they said that on the ivermectin it had said, the box or label, that not for children under 15 kilogram of weight, pregnant women, breastfeeding women, or elderly. So the reason for elderly only, I think, is that it is a general protection given that way. Talk with your doctor. There is no known side effects specifically of ivermectin towards elderly. So keep up with med says, many cases, and nowadays, just in general, because I think I'm myself now 52, definition of elderly should be anyone after, let's say, 150. We are all young. The medical system has advanced so much that it can help. Many cases developing this heparin-induced thrombocytopenia, like event post-vaccine, we know they end up dying because of brain hemorrhage. As thrombocytopenia happens, won't rivaroxaban cause more harm in advanced stages? And that is why this has to be done with doctor's advice. They have to see what is the situation. For example, if the situation is that the patient is in thrombocytopenia, that means so much thrombosis has already occurred that there must be damage as well. So now they have to see, do we give platelets or do we give blood thinners? So on one end, they have to give blood thinners to make sure thrombi are broken down. Thrombi are removed from wherever they're clogging. And on the other hand, they also have to make sure that where the thrombi need to be formed, which they need to be formed all the time in our body to seal microscopic punctures, then they have to see that as well. So they would figure out God forbid if this happens to this kind of a severity that thrombocytopenia has occurred, so much thrombosis has occurred, that means patient is going to be in hospital, and then they would have to figure out what is the right balance. Then rivaroxaban alone is not the right solution, unfortunately. Roman says, did you have a chance to review Adam Gaertner's argument on vaccine resistance and possibly a dead virus emerging? I'm going to pass on that one. So I understand that theory. We looked at that theory as well. But there is a clinical set in front of us as well. And we are seeing that is not something that is happening too much. I've been keeping quiet about it intentionally. Fran says, I meant which option is better, no vax and treat disease with ivermectin to take vax to prevent. So I'll tell you myself, I am taking prophylaxis with ivermectin, but I am looking daily because I become eligible. I'm looking daily to get my shot for vaccine. So I am going to take my shot. My hope is I don't get an adenovirus vaccine. Instead, I get messenger RNA type vaccine. That is how I am planning. My best would be Novavax. I think Novavax is not here yet. Then my second are messenger RNA ones. And then the third ones are the adeno. This is why a few days ago, I compared the three vaccines, the Moderna, Pfizer, and Johnson & Johnson. So basically, you can see that is messenger RNA versus adeno. And people just hated that I compared them. I actually go back to the same tables to see for myself that, okay, this vaccine can cause this. Some vaccines can cause tinnitus, and that tinnitus can become permanent. Some vaccines can cause blood clotting that can kill. And so knowing for myself that, hey, what is it that may be the least harm? I think I have a right, and I think people have a right. And I don't understand why other people are just being upset. And I do not like this disingenuous way of commenting to say, by your action, you are causing people to become anti-vaxxers, or you're bringing anti-vaxxers in. It's very simple. I'm providing information. I am doing something that a book does. So you don't start beating up the book to say you are making anti-vaxxers or you're making vaxxers. It is information. It is important information. It saves lives. Okay, so Arun says, so platelets and blood thinners both should be given in HAT hemorrhage. So Arun, this is what doctor has to figure out. They have to run the labs to figure out what is the situation. They have to see how much thrombosis is happening. They have to see what is thrombocytopenia. Then they have to figure out what is the right mix of the treatment. Sumeet says, touchwood doctor, I haven't seen a single person ivermectin prophylaxis getting COVID since 1 year. More than 1,000 people have given ivermectin who feels it's a chance, then worth a chance. Absolutely, Sumeet. And WHO statement is such a bizarre and incorrect and fraudulent statement that they did this, and there is no repercussion for these folks. I get threats all the time for telling these things that are verifiable. And then here are sitting organizations, big pharmas, making wrong decisions, incorrectly presenting the data, showing the data which is one way and then narrating it in another way. And they're getting away with that. And people like me are getting threats. It is interesting. And the WHO comes out and says this is as good as chance. Okay, so let's keep going. So Kurt says, so let me look at Kurt's question. Sorry, full question. Is there any problem taking ivermectin after getting first COVID vaccine 10 days before testing positive? Okay, so let me read this. Any problem taking ivermectin after getting first COVID vaccine 10 days before testing positive? So there are three things that are happening here. Getting first COVID vaccine 10 days before testing positive. So you got the vaccine 10 days after you became positive as well. Now you're asking, hey, if ivermectin can be taken. Yeah, so I had thought that ivermectin will not be stopped. But yes, if somebody got the vaccine, then they tested positive, developed symptom 2 days, 5 days, 10 days, 20 days. take ivermectin. And again, not an advice. Talk with your doctor, please. My fear is that we are trying to do a good thing here, and those folks who are upset with folks like us are going to just start reporting these things and bring it down. So please don't put yourself in trouble. Talk with your doctor. But yes, you can take ivermectin, or someone in this situation can take ivermectin. Keep Up with Med says, when vaccine boosters are developed with people need to take the booster from the same vaccine brand as the first dose, can we mix vaccines and boosters? So that is what they are testing in UK, and they have come back, I believe, with some initial data that says it is fine. The way I look at it is the following, and I had done this talk in the past as well, that I thought it was fine. And here's the reason I thought it is fine. So let's see this. Imagine this is the virus against which you want to create immunity. And you took, in one vaccine format, you took this spike protein as the antigen, and you produced it in your cell, and you had your immune response, correct? So this is all good. This is what happened. Then another vaccine comes along and also produces the same spike protein. And it is possible that if this is the spike protein, one vaccine produces this part of the spike protein, and then the other vaccine produces, let's say, this part of the spike protein. And now, when you had taken the first vaccine, that produced the immunity against this black part, this part, and now you took the second brand which produced the immunity against this red part. That's fine. That is okay. The question, when I discussed it before, the question is going to be the adjuvants, the other things that are present in the vaccine, fetal tissue copy issues, the kind of adjuvant issues, the kind of preservatives, and those things. But the vaccine itself is still creating antigen. So one vaccine or the other is fine. This is just like getting infected once and infected again. So yeah, no worries. At least that is the discussion from a mechanism point of view. Jack says that US tried to dump WHO. That is correct. But look what WHO just did. Sumeet says, can we bypass WHO officially? That's a problem. We can't. So there are so many organizations who are going to stay compliant so that their systems can continue to work and they are not sued. For example, if somebody does not give me an ivermectin and I die, and my family members go to that doctor and say, why did you not give ivermectin while it was possible? Doctor would say, CDC said no, FDA said no, WHO said no, what are you talking about? On the other hand, if, let's say, somebody gives me ivermectin and I die, and then my family goes to the doctor and says, WHO said no, why did you do it? So that is the basic problem, that these organizations, when they take a position, that opens up the doctor's prescribing to liability. And if people can just be upset here to my talks, in the last few days, I've seen it so much. Imagine if somebody's family member has died, and imagine the emotions and grievance over there, and then imagine what they can decide to do with the doctor if they are upset. So Saim says, my question is, I got mild tinnitus in 15 minutes after first dose in Pakistan. I got fatigue, pain, headache, and all settled, but tinnitus is there. Is it safe to get second dose? So Saim, I have no idea how far back, but I would just say this, that there are many folks who are saying that they are getting tinnitus with some of the vaccines. I do not know which vaccine did you get. Please ask them that what is the time duration for the tinnitus. Ideally, it should go away. In some cases, I'm seeing from the patient, they're saying, no, it is not going away. I'll give you an example of an infection causing tinnitus of a very popular doctor who talks as well on the internet. He got tinnitus from the infection, not vaccine. And he said after taking fluvoxamine, the tinnitus went away. So you may have to, and I know you're in Pakistan, things can be taken over the counter, but please do not take fluvoxamine over the counter. It can cause suicidal thoughts and cause a person to cause suicide. So please don't take it over the counter. Talk with your doctor, see if they can give something like fluvoxamine, and if they can see you can take them, and then help you with that. So your question about the second dose, I have no idea. Ideally tinnitus should go away. M. Gregory says, why would it give tinnitus? So M. Gregory, that day when I did the vaccine comparisons, I talked about it. Some of the vaccines can cause enough inflammation that the ear system and the nerves do not work correctly, and tinnitus occurs. Sometimes it goes away. Majority of the time it goes away. For example, when I was showing, the vaccine had 6 cases of the tinnitus. 5 got resolved. 1 was not resolved. Then similarly, I have a Cool Bean. I do not know if he responded a few days ago. Let me just quickly see. A few days ago, they said that, hey, I developed tinnitus, and they are saying after the first dose, and they still do not have it. So he's saying, I'm a research nurse practitioner in Cornell and ended up Pfizer, had tinnitus. This is January 19. So since January 19 till today, the tinnitus is persisting, and they are now trying various medications to help. So vaccines can cause tinnitus. So Rajesh says, oh my God, I had ringing ears plus throat irritation plus mild cough earlier this week. Ivermectin Zindabad. Yes, ivermectin is very useful as well for SIAM. Please talk with your doctor as well and see ivermectin. Folks have reported improvement with ivermectin, but in case of tinnitus, more drugs may be needed. Khalid says vitamin D3 is your free vaccine with ivermectin. Yeah, so vitamins, we have been talking about it for a very long time. Vitamins and ivermectin, hydroxy, zinc. There are so many solutions that are actively being suppressed. So when Dr. Corey, I was listening to him, when he said they have become irrelevant to me, they have become harmful. They are still relevant, but in a harmful stage. Bert says, so you need other medications to prevent serious side effects if you take a vaccine. No, so what happens, Bert, is that between the vaccine and then becoming fully protective of the vaccine itself, there is time. So for example, various vaccines have various doses. I did this video a few days ago comparing 3 vaccines. In there, I discussed that, for example, Moderna dose 1 today, 1 month later dose 2, and then they say full protection, full immune system activation 2 weeks after that. So that means 1 month and 2 weeks, 44 days. Before 44 days, a person is still susceptible to get an infection. The efficacy is somewhere in 50s, so half protection, but still they can get the infection. After the full protection, there is no guarantee. It is still 94% protective. That means there is still 6% chances of getting the infection. So it's not always full, but before full, that is before the full protection that they call at 44th day, you can still get infection, or some people can get infection. The question is severe disease. What they have seen is that after full, severe diseases do not occur, although we are seeing reports from Pfizer, Israel, that they may be severe, but really smaller number. So that hopefully answers this question. So Patrick says, does anybody know what time the qigong session will be? So today, Patrick will meet at 6 p.m. That would be 9 p.m. Eastern time. I would talk for 10-15 minutes, and then we will switch to qigong session as well. I do not know, do we have to stop and just do that? But expect it from after 6, and I would share a Zoom link that we would use to, number one, do our little chats as we do every Friday, plus qigong. Jessica says, which is the best vaccine? So Jessica, it really depends upon age. It depends upon comorbidities. It depends upon the adjuvants and your body's response. I did a video 2 or 3 days ago called Comparing 3 Vaccines, where I compared Moderna, Pfizer, and Johnson & Johnson. So please watch that. It's a 20-25 minutes video. It was actively disliked by many folks, more than normal. So if you go and see the thumbs down, there are many people who have thumbs down on it. I think people were just upset that why am I comparing vaccines? But these kind of answers can be seen by watching that video. Simple Meerkat says, vaccine dose adjusted by body weight at all? No. I'm sure that with the children now they are testing and they may be changing, but for adults they have not changed it. And you are correct in your theory. Maybe there is a body weight to vaccine ratio issue. I hope that they are collecting this data. So Kanishk says, is there any possibility to acquire clot-related side effects with AstraZeneca vaccine with its second dose, but haven't got any issues with its first dose? Don't know. So this is my theory, my opinion, that if somebody did not react to it negatively the first time, they would not do it the next time. So that is just my opinion, but that is not a guarantee. For example, if I counter my own point, maybe somebody's immune system did not react robustly the first time, but when the next time the vaccine was given, then it was even more robust, and then it created enough antibodies to cause that hurt. But to counter this one, the vaccine usually, this specific case is only in some people, the vaccine triggers some sort of an immune response that causes the antibodies against platelet factor 4. And if that is going to happen, it's going to happen with 1 dose or 2 doses. So because of this, and if the companies had acknowledged that this is because of vaccine, they may have gone back and done some research and come back with data and say, here is what to be careful about. They have simply not acknowledged. And because of that, we actually do not know other than doing these guesses. So unfortunately, I can't really say what would be the right outcome or what would be the outcome. Anubhav says, can the different vaccines efficacies for AZ in different countries be because of variants and not because of half? Anubhav, don't get me started. So this is also, people keep blaming me that I am talking about AstraZeneca in not a great light, but these are not my issues that happened. Half dose, full dose, duration. First they said it was half dose, full dose. Then they said, no, this was about the duration, that it, instead of 3 weeks to 6 weeks to 90 days. So there is a lot of confusion in here. And of course, originally they said it may have been something to do with the variants as well. Then they said, well, half dose, full dose. Then they said duration. So I have tried to clarify this a lot. I actually, in my discussion, said that it seems like AstraZeneca's arm is being unfairly twisted. This is my statement. So I actually protested that they are being unfairly targeted. At the same time, AstraZeneca has been not very good with their communication either. Kevin says, Dr. Bean, I spoke with Dr. Syed Haider regarding mRNA vaccine, and he mentioned there was one animal study done once showing that the lung damage from SARS-CoV-1 is actually caused by vaccine. I have talked about that study. There was a study in which they showed that the vaccine could cause ADE, leading to pulmonary damage. And I had done that discussion. They could not reproduce that in other animals or humans, but that means there is a theoretical chance. So if you watch my video in which I discuss this, that video was AD, antibody dependent enhancement. And I have discussed the 5 types in there, and I've discussed these studies, and one of the studies was this one as well. So in theory, there is a chance of doing that by active infection or by the vaccine, but it has not yet been seen. Doug Johnson says Dr. Bean is legit. Thank you very much. ZEYNSOLO says, is it possible the vaccine contains harmful soft metals? So aluminum has been an adjuvant in some of the vaccines, and that is to kind of bother the immune system, trigger them, and kind of make them react. So that has been there. Not in all, but some. For example, Pfizer and Moderna says that they do not have adjuvants because their own lipid particle itself acts as enough of an irritant that they don't need adjuvants. Other vaccines have adjuvants, and in their FDA briefing, they have written the composition of what is included in the vaccine. Nettlecat says, seems like people want you to sugarcoat everything to make them feel better. What is happening is that I am finding out that we have corners, we have our biases. I have my biases as well. So we have our corners, and we tend to gravitate in the echo chamber, in a chamber where where discussions happen in such a way to strengthen our beliefs. So anything that kind of destabilizes that belief, we try to go away from it, or we try to dismantle that thing to say this is wrong. And then there are echo chambers or echo chambers, whatever way it is pronounced, present. So I have my bias of being pro-vaccine. I have my bias of being pro-hydroxy. I have my bias of being pro-ivermectin. It is actually a very strange combination, because you would see many folks who are pro-ivermectin are anti-vaccine, or many folks who are pro-vaccine, pro-ivermectin are anti-hydroxy. And then there are many who are pro-hydroxy and anti-vax. So, and there are many pro-vaccine who are anti-ivermectin and hydroxy. So I have a strange combination. The combination is this way. It's not a bias I developed because I was just thinking to create a bias. It is based on the studies that I saw. So when I say something that, so I have a majority of the cool beans who are kind of in similar ballpark. So when I say something that kind of breaks that kind of corner, they become upset with me. So the point is, I had been saying it from the very beginning that I would try to present the data as it comes, so we are informed and educated. We can then decide. You all are adults. You can decide then to say, okay, I'm going to be careful here. I'm doing this for myself. I am researching vaccines and looking at their adverse effects to make sure whatever best I can do to protect myself. Then I'm still going to go get vaccinated. And even then, if I get a reaction, then I get a reaction. What can I do? So being careful and educated and informed has a great value. That's all I'm offering. That is where I stand. Jessica says, we appreciate you, doctor. You are important to our lives. Don't let your trolls get to you. Absolutely. I will not. But here are some of the downsides. For example, because folks start reporting, YouTube then comes out and blocks my videos. Nowadays, they don't block it. They just demonetize it. So I cannot even get that 2 cents from a video that I could to support myself. And so these are various ways to punish someone who you do not want to hear saying something that you don't want to hear. Okay, so let's continue. Doug says, Dr. Bean, I'm upset with you. Not really. Thank you, Doug. Don't be upset with me. I have enough folks already upset. Zain says, it's okay, Dr. Bean, just be yourself. Yes. Colin Hamel, I have 10 minutes. Colin Hamel, says, are you still interested in animation? If so, I left 3 messages below last night's chit chat that will either get you a program or animator. I would love it. So the whole day last night, I kept scouring Fiverr to find out people who could make animatics or those things. And I have started discussions with few. So if you have someone who you can, that would be great. So I left 3 messages below last night's chit chat that will either get you a program or animator. Okay. So I have I have Adobe Suite. I have a program called Storyboarder. I have another program on my iPad that is called, what is the name of that program? It's a beautiful new program, Calipeg. It is a beautiful animation program. The point is to be able to take time to do those things. So I finally thought I would have to spend some money to get this done because I do not have enough time to do those things. So I would look through that chit chat and see. Alexandru says, can the spike protein be produced by the vaccine enter the bloodstream and bind to the ACE2 in the vascular endothelium? Is ACE2 also involved in the clotting mechanism? So Alexandru, we have talked about it a few times before. Let me explain that once more. Short answer is no. And I have done a detailed study. 2 of the important concepts that people ask me all the time. One is that will the spike protein just continue to be made? This concept started from Cahill's messages that she said we'll become mutated organisms and we'll just have spike proteins everywhere and we'll die at some point. So that caused this panic and people said, well, will we just continue to make spike proteins forever? And because she had said that the cells will be modified forever. And the second question was, somebody started this message as well, that spike proteins would just go everywhere and bind just like the virus binds to ACE2, and they would trigger and they would cause the damage. So let me just very quickly explain that part. And we have the cool beans here who have been hearing for some time. They know what I'm going to say. So what happens is, when a vaccine arrives in our cell, it enters a cell. And then inside the cell, the messenger RNA comes out of it and it is fed into our ribosomes. And then those ribosomes make spike proteins from it. Now these, I make them illustrated like this, but normally what happens is, if we actually go inside the cell, there is a chamber called Golgi apparatus. With that are sitting ribosomes. So there are 2 types, smooth endoplasmic reticulum and rough endoplasmic reticulum. And the endoplasmic reticulum here has these ribosomes attached to it. That is why it is called rough, because when you see it under the microscope, it looks like it has dots on it. These dots are actually the ribosomes attached with it. And the ribosomes have the RNA going through them. And so imagine these are chefs who are cooking, and what they're cooking is thrown inside this chamber. So the spike proteins are thrown inside these reticulums, or you can think of them as pots, like cookers in which you are cooking things and putting there, or fridge maybe. So in this pot, then this antigen that is produced is then going to be broken down into smaller pieces or handed over to another chamber. This is like, if I can use an example from real life, this is like a criminal who has been arrested and has been processed from police station to jail. So here we have this spike protein. It is now going to be going into this endosome. In the endosome, it is shredded and broken down into pieces. And even those pieces are not thrown out inside the cell. We are still inside the cell. They are loaded. They are given into further chambers. And then this is loaded. These pieces are loaded on major histocompatibility complex. And just to show you that what I'm saying is true, I'm going to show you here. If you just Google MHC2 loading and you go to the, let's say, images, you would see here. So for example, if you see, I do not know whose diagram is this. I'm not doing a copyright violation. I'm just hopefully just for education purpose. So here is some virus that is brought in, and then virus is broken down and digested by phagosome lysosomal fusion. And then if you see here, those pieces of the virus that are broken down, those pieces are brought here in the Golgi apparatus, and then they're loaded onto, do you see this yellow thingy? This yellow thing is MHC class 2 molecule. This MHC is created here in the endoplasmic reticulum, and then it is brought in here where the pieces of the virus are. Then they're loaded together. Then this, they are missing a point here, that this MHC2 with loaded antigen is put in a bubble. That bubble is brought all the way to the cell membrane and fused there, and it stays there. It does not get out. It just sticks to the outer side. Then these cells come, for example, this is a naive T helper cell, CD4 cell, and the immune system would start. This is the process of how controlled our immune system behaves, our cells behave, how responsibly they behave, to make sure that any antigen that is inside of them is not thrown out just willy-nilly. And so this is always presented. So your question here, that can spike proteins get out and attach to other cells? Impossible. Now, let me offer another part, that when can this be possible? So if you said, pretty please, I want the spike proteins to go out in the cell, can we, in the blood, can we do something about it? So yes, what we can do is this. Imagine this cell is presenting the spike protein pieces to naive T cell, and the T cells are working. It is possible that when it is presenting the spike protein pieces, some cytotoxic T cell would also be bound to this same cell. So this is a cytotoxic T cell or CD8 plus cell. Or it is possible that there is a natural killer cell that is also attached here and seeing what the heck is happening here. Or natural killer cells are sort of perverts, so they are kind of putting their hand on this cell and seeing if this is a sick cell. These cells can in turn break this cell. And if the cell is broken and there was some spike protein that were just sitting in these pieces, that when these pieces, apparatuses, are opened up just like an egg, it is possible that some spike proteins might spill out. Not a lot. And now, so let's say you got your goal. You said, pretty please, I wanted spike proteins outside, and here is a mechanism Dr. Mubin is showing that it is outside. Now the question is, you'll say, aha, so I am right. Now these are going to go everywhere and destroy us. So no, number one, they're not in that larger quantity. If they're coming out of 1, 2, 10, 50 cells, that's not a lot. Number one. Number two, these spike proteins, these enemies who are in the interstitial tissue. Interstitial tissue is a tissue amongst the cell, between the cells. So these are the cells, and the spaces between them, these spaces are called the interstitial. I'm sorry, I'm fast because I have a meeting and I have to stop this as well. So this is called, these spaces are interstitial tissue, correct? Now, in the interstitial tissue, antigen is just not allowed to roam around as if it is a safari park for it. There are macrophages sitting here, and they are looking at what is going on. There are neutrophils sitting here. There are NK cells sitting here. There are so many cells that are everywhere in the tissue. And as soon as a neutrophil or a macrophage or a dendritic cell sees that there is an antigen, they are immediately going to attack it and eat it up and process it and present it. So for an antigen to kind of just decide to run around in our body is very, very difficult. I'll tell you. So if you come back and you said, no, I want it to be running around in the body, give me a mechanism that would do that. So then a person on their deathbed who has become so much debilitated that their immune system is not working, their blood vessels are, dilated, for example, as happens in the septic shocks or acute respiratory distress syndrome in SARS-CoV-2, then the virus would come out and would run around everywhere, and our body cannot protect ourselves at that time. Can a vaccine do that? No. Why not? Because the virus is actively increasing in number by going from one cell to the next cell and to the next cell, and they are just increasing in number. They're causing immune system to be excessively bothered, create inflammatory cytokines. That whole thing together causes this problem. Vaccine doesn't do this on a repeated basis. A small 0.5 milliliter or 0.3 milliliter dose is given, and that's it. That's it. That dose is destroyed in a couple of days and gone. It cannot do more than that. Because of this, it is not an active infection. So it cannot, you bring in whatever mechanism for medicine, it can still not survive in the body for long. So I hope that answered that question. Sorry, I went fast. I wanted to continue. So is it okay if I 877 Swissmith says, I missed what he exactly Googled. Very simple. I Googled, and there is a super chat as well, sticker as well. Thank you very much. I Googled loading MHC2, and 2 is II, MHC2 loading or MHC1 loading, and you would see this. So I have my next meeting. If you, Jess says Jelly Bean, absolutely. And I hope this was useful. There is a question here. So yes. So is it okay for 877 says, I have 10 years of biochemistry, I started biology studies then, but stopped when we had to go into animal test labs. Horrible. Yes, agreed. Is it okay if I can take tomorrow off? I'm going to request the cool beans in the evening as well, if I can take tomorrow evening off as well. But today evening, I will come in, and this evening we'll have our discussions as well, because I've not announced it before. So please stay safe and happy, healthy. Stay comfortable, that you are informed, you are educated, you know how things are, you know solutions. It's a matter of going and finding them. So don't stress out. Please stay relaxed. And if you can do me a favor, I saw Dr. Corey was very, very forceful in saying, hey, please donate and help support our work. If you can support this work, it is great. I can get some creative, some artists to do those kind of things. Today, I do all of this by myself, and I try to do as much as I can. So if you can support it, it is great. Please like, subscribe, and share. That is a big support as well. Other than that, there are 3 links in the description. One is to buy me coffees. That is a kind of a support. If you would like, you can be a patron as well. And then there is a link to support in general too. So thank you very much. And I would see you in the evening. And for the Europe, Asia, Africa, I'll see you on Monday. Stay safe and happy. Bye-bye.